Just a moment, it's almost done.
Just tell us when.
All set.
All right, I think we are live and ready to go. Welcome everybody to our virtual stop on our Texas tour. We are excited that you are here. And if you're joining us live, thank you for joining us. If you're watching us on the recording afterwards, also thank you for joining us. We are thrilled you're here. My name is Kim Coffrin. I am the Senior Director of Education here at Children at Risk. Lucas is also with me, our Associate Director. Have been traveling the state the month of October, and we've got one more stop in Austin tomorrow, and that will conclude our fall Texas tour. And so we did this last year. We added a virtual stop for those of you that couldn't make a in-person event, or we didn't get to your corner of the state because the state is big. So we are thrilled that you are joining us. So we're going to go through some data. I'm going to actually share my screen and get the PowerPoint up and going. Let's see, I want to do this one. Let's see, make sure I do this correctly. Lynn, are you seeing presentation mode or are you seeing the notes?
I'm seeing the notes.
All right, that's what I thought. Stop share and do it this way. How about now?
I think there we go.
All right. So, the dual monitors, I can't live without them, but every time I do this, it's always a little bit of a switcheroo. So like I said, Lynn and I have been traveling the state for the last month, and have been in community and got to hear lots of voices from the field and from Brownsville up to Amarillo, and from El Paso all the way over to Tyler and Houston. So thrilled for you to be with us. If you guys have questions for us throughout the time, please use them. Use the chat or the chat box so that we can capture those notes. We've got Bree on the other end that's helping us with those pieces. So feel free to jump in and ask those questions. So let's get started. So those of you who are unaware, Children at Risk is a statewide organization that serves as a catalyst for change to improve the quality of life for children through research and data, and then along with collaboration and community, which Texas Tour is a perfect example of, that then really informs our policy work. So we are thrilled to be with you. Lynn and I are with you today, as well as our fearless leader, Bree, who's behind the scenes. But this is the rest of our ECE team that supports our work and supports our mission. So we are, again, thrilled to be with you. We are also part of the Prenatal to 3 Collaborative. This is a collaborative that started in 2019 with funding from the Pritzker Children's Initiative. It is in collaboration with our partners over at Texans Care for Children and Tex Protects, and really gives us an opportunity to focus in on our 0 to 3 age group. And so it's a time that we can really focus in on the needs that are specific for infants and toddlers and families that have infants and toddlers. And so we divide that work into three different buckets accordingly with our 3 different partners. So Texans Care for Children focuses in on our healthy beginnings. Tex Protects really leads the work around supported families, and then we lead the work around early childhood education. That QR code that's there in your lower right-hand corner is to sign up for our Prenatal to 3 newsletter, which will go out either today or tomorrow. So if you sign up for that, we send it out every other month, and try to keep you posted on what all 3 organizations are doing specifically around those infants and toddlers. So sign up for that and join us. Where we wanted to start, where we have been starting our Texas tour and our conversation is really around Prop 2. Last year when we did Texas tour, we were really focused on getting the constitutional amendment passed through the state, which was Proposition 2, which was the amendment that really gave property tax relief for childcare providers throughout the community, throughout the state. It passed with 65% of the vote last year, which was fantastic. It passed in around the state overwhelmingly, which was exciting news. It was the first time in Texas history that we were able to vote on childcare as citizens, and so it's really a marker in why we think this is important. The way the bill language was written was it allowed cities and counties to adopt those property taxes. And so once it passed the constitutional amendment, then cities and counties had to go the next step and get it passed at their local level for that to happen, for childcare providers in those communities to benefit from it. This is our current list of cities and counties. We actually have a few more that we need to add to the list, including Cameron County, and we need to follow up on Lubbock because Lubbock was also in the process of potentially getting it passed in their community. So we are continuing to focus in on those communities. We're hearing some really good reports. There's some good communities that are really tracking the progress and the savings that providers are happening across the state. And we're really it's tax season, and so property taxes are about to be due. So this is the first time that we're going to see those savings, and I'm really looking forward to hearing from providers across the state on how that really affected their business and where that really made a dent in that piece. If your community has not adopted it yet, there is still the childcaretaxrelief.com website that has all of the resources available for you to provide. So we can drop those into the chat, and we'll do we can do a link in the Facebook live stream of all those resources. So if your community hasn't adopted it yet, feel free to use that resources to help build those communities and build that language around. It gives you the language that way as you talk to representatives and your local officials in your community on what the property tax does. It is not too late. It is not a one and done type of thing that you missed the mark. Cities and counties can adopt that at any point in the future. It is now a constitutional amendment, so it's just a matter of continuing to work our cities and counties. One of the things I have said with property tax too, it is not the bill that is going to fix all of our child care issues. It's a great start, and it's a great relief, and it's doing some fantastic relief for child care providers across the state. But it is also an opportunity for us to really talk to local officials, because of this adoption that the cities and counties have to adopt it. It gives us a chance to really think about have conversations with people who don't think about childcare very often. Cities and city council members and mayors and county judges across the country that are across this, well, Texas is a country, across the state, that hasn't really talked about what their purpose is or what their role in the solution of childcare is. And so it's giving us as childcare advocates and providers across the state the tools that we need to knock on those doors and to send that email and say, hey, have you talked about what the city and county can do to support childcare and why this is important to our economy and why it's important to our families and our community? It's going to take all of us at the local level, at the state level, and the federal level to solve childcare. And so this is kind of giving that local something, an action item that they can do for that. Is there any questions in the chat box?
At this moment, I'm not seeing any, but I do encourage all attendees to drop your questions and we can engage them live real time.
Perfect. Thank you, Bree. Awesome. Okay, with that, I am going to move us on to Lynn, who's going to talk about our childcare desert data.
Thank you, Kim. And it's been, welcome everybody. It's been interesting to be out across the state and hear some of the feedback. So I do encourage you, if you have any feedback or experience with Prop 2, that you do go ahead and put that in the chat for us. We learned, for example, that one provider, she rents her space, but the rentor, the person who leases, oh gosh, I'm not even getting the words right. The person who leases,
The landlord.
Thank you. Her
It's
landlord
okay.
passed down that savings to her. So she saves like $300 a month on her rent. And so that was really great for her. And another provider was able to pay for hurricane insurance, and she lives in the Gulf region. So it was really great to kind of hear some of those stories across the state. So thank you for that. Okay, so now let's talk childcare deserts data. I'm going to share with you some statistics that might be very familiar to you. Even if they're worth repeating. And if they are new to you, then I encourage you to pay super attention. These are great things to remember to pass along to other people to help underscore the importance of the work that we do. So if we took every child in the entire country and lined them all up against a wall, and we're trying to figure out how many of those children belong in Texas, our Texas children, we would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, Texas. 1, 2, 3, 4, 5, 6, Texas, Texas, Texas. So every 10th child belongs in Texas. It's a lot of children. It's huge. It's a very big opportunity and also responsibility that we have in our state to take care of those little ones and to be able to do right by them and their families. There are 2.3 million children in the state of Texas who are under the age of 6. So that's a lot of little ones that we have the opportunity and responsibility to impact their lives. 1 in 10 children under the age of 6 in the state of Texas with low-income working families live in a childcare desert. What is a childcare desert? I'm so glad you asked. Childcare desert means that for every seat that's available for a child, there are 3 children. So, I mean, I think of musical chairs. Can you imagine there's one seat, you have 3 children who are eligible for that seat. One gets the seat, and the other 2, it's like you're out. Well, we need to do better than that in Texas, and we certainly do intend to. Next slide. The early childhood ecosystem. So access, families, and educators. When it comes to access, we know that 44% of all zip codes in the state of Texas qualify as a childcare desert for low-income children. So that, again, that means that there are 3 times more children who live in that zip code area than there are childcare seats that are available for those children. So this means that there's not equitable access for children who need care that come from low-income families. Let's talk about families. So in Texas, we know that families who have children that are infant and toddler age pay between 10 and 50% of their annual earnings to childcare. I mean, it's insane, especially when we consider that the federal recommendations for that expenditure is that a family would pay no more than 7% of their annual income. And if you do, or anyone who does pay for childcare, that that's a really huge strain on a family. And so, I kind of ask you, when it comes to poverty and kind of solving a lot of our problems, wow, what a difference it would make if if that one thing changed and families who have children didn't pay more than 7%, it would make a really big impact. And educators, well, we certainly need high quality educators to do this very important work. And we know that more than half of early educators qualify for at least one form of public assistance. Why do I mention that to you today? Because that's just an indicator of something we already know, which is that we don't pay people enough who do this extraordinarily hard and important work. So now we're going to talk about childcare deserts in 3 different ways with 3 different populations. We're going to talk about it in terms of all of childcare. We're going to talk about it in terms of subsidy childcare, so scholarships for children from low-income working families. And we're going to talk about it in terms of quality. So this first number, by the way, before I talk about these slides, these are going to be statewide statistics. I highly encourage you to go to the Children at Risk Childcare Deserts map. You can see that here in the chat. And because you can look at anywhere you want to in the state of Texas, but I definitely encourage you to look at your local area and see what this looks like for you. So overall in the state of Texas, there are just over 1 million childcare seats. Where do we get this number of seats? It's very important that I let you know that this number of seats comes from the licensed capacity that childcare licensing has. I mention that because this is overstating the number of seats that are actually available. Anyone in childcare knows that often childcare centers, homes probably too, are their license capacity is not actually what they intend to be able to provide. They may run lower ratios. And just practically speaking, there may be a classroom that can't be opened right now because there's not an infant teacher, et cetera, et cetera. So it's I just wanted to point that out so you have that information. But with that, we know that there were 365 zip code areas in the state of Texas that qualify as an overall child care desert. So here we see subsidies child care deserts, and we see that the situation gets a little bit worse now that there are just over 100,000 child care subsidy seats available, and that leaves us with 859 child care deserts for subsidy. And lastly, we're going to look at the quality. So this is looking at quality in terms of Texas Rising Star, which is Texas's quality rating system. And we can see here that there's just around 40, just over 48,000 number of TRS seats. And that leaves us with 981 zip code areas in the state of Texas that are quality childcare deserts. So it's huge. We can do better than that. Definitely go and see how your community is doing, so you're armed with that information when you talk with people in your community and in our state. So let's look at some longitudinal data. Here we can see that over the past 5 years, this is child care centers only, and we can see that what happened when COVID happened. So we see where we were. Each of this, by the way, each of these represents a child care seat that represents 100 families. So we can see where we were in 2019. We see the huge dip we took in 2021, and we see, if you look at the red, that's all of childcare that we recovered. Wow, yay, childcare recovered. That's fabulous. And it's really important that we look at numbers within numbers, because what we notice is that with subsidized childcare, the gray line, we notice that that one did not recover. And what do we notice when we look at quality? When this example, looking at any TRS program, and we see that those have also not quite recovered. So while it looks like childcare centers have recovered overall, we definitely have some work to do when it comes to taking care of these other populations. But now we want to look at childcare homes, family childcare homes, extremely important population. And so we can see that while childcare centers recovered, family childcare homes did not. That there is an 80% decrease in family childcare providers. And why is family childcare an important thing in our community? Because there are some things that family childcare homes are able to respond to, are more likely to be able to respond to than centers are. For example, childcare homes are more likely to make language and cultural accommodations for families that may be really appropriate to a specific neighborhood. Childcare family homes are more likely able to care for children who have special needs, including special medical needs. And family childcare homes are more likely to be able to provide non-traditional hours for families that might extend into the weekend, late at night, very early in the morning, to take care of second, third shift workers. So super important that families have those choices, and our economy and our families depend on it. This is a visual for you to look at the overall child care need and the way that we're able to respond to it as a state. So each of the children here represents 10,000 low-income children between the ages of 0 and 5 who have working families. So these are all children who would be eligible for child care services, so a scholarship assistance. And the children who are in red represent the children who get the service. And so the point in this is to reflect that we're able to respond to 13.4% of the need. We have about 84,000 children in the state of Texas on the CCS waiting list. That's just too much. All of those families are trying to make their worlds work. They're trying to make they're trying to go to work, and the people who work with them, you know, you might be one of the people looking for the work, or you might be one of the people sitting next to someone at your job who needs that. And everybody in that situation needs that person to be able to have childcare and be to work on time and be able to focus on the good work that they're doing in order to make our whole lives work all right. So, and with
Thank
that,
you. Thank you.
I'll
Thank
pass
you,
it back
Lynn.
over
Thank
to
you,
my
Lynn.
colleague, Kim.
Bree, any questions in the chat box? I know that was enabled and now I think, is it fixed yet?
At this moment, we do not, but I was just typing a chat to let everybody know to share your stories in the chat box with us. We want to hear what you have to tell us, and we really want you to engage.
Perfect. All right. So Lynn just shared with you the data around the access and our deserts across the state. Probably if you're been around childcare for a while, no real surprises. That was all data based on September of 23. September 24 just ended. And so we are in the process of collecting that data from Texas Workforce Commission now. And so we'll be doing those analysis over the next few months. So stay tuned. In the new year, we will have new updated numbers. I'm anxious to see what those numbers are. From 23 to 24, because we know all the ARPA dollars have ended during that time frame, and so I'm very curious to see what those numbers will look like now in 2024. So with that, we also have looked at how we are spending our quality dollars. Back in April of 2022, Children at Risk released a report called The Quest for Equity and Quality in Our Texas Rising Star System. And we did many focus groups across the state with child care providers, both centers and homes, on their experience with the Texas Rising Star System. And one of the big takeaways from that was it really depended on which workforce board you were in on your experience. And so there's 28 local workforce boards across the state. No big surprise that there's differences amongst them, but it was a kind of a wake-up call that yes, that really affects a provider's experience with Texas Rising Star. And so we wanted to look into what those differences really were, and how workforce boards make those decisions. At the same time, Texas Workforce Commission started to release the report, the data around how workforce boards were spending their quality dollars for Texas Rising Star. And so we actually had some data now then to be able to look at. And so that's what what this new report, Paving the Way to Quality, that we released back in October, or last month, is looking at. It's looking at how those workforce boards are spending those dollars and what difference that is making on their Texas Rising Star pathways. So that QR code will take you straight to the report. You can also go to our website and find it there as well. So it is there for you to use, and to dig in. We'll dig into those results. Okay, clicker, there you go. So let's kind of do some level setting. So all of the funding that we have in Texas for childcare funding is through through our portion of the Child Care Development Block Grant. That is a federally funded program, and grant year 23, we received just over $1.1 billion from the feds to administer our child care program. In Texas, that all gets funneled through the Texas Workforce Commission, and then those get funneled to the 28 local workforce boards. The federal rules require that no less than 70% of those funds can be used for direct care. And Texas meets that. We use 70% of those funds to service kids. Then it says no less than 9% can be used for quality initiatives. So what is the state going to use to support quality for childcare providers? No less than 3% can be used for infants and toddlers quality initiatives specifically, and no more than 5% can be used for administrative fees. So those are kind of the parameters that Texas Workforce Commission and the workforce boards have to kind of live in, and they all do. In order to draw down that 1.1 billion, we have to put in a state match. And for us, that is about $34 million that we as a state put in to be able to draw down that. We are looking at somewhere between a $20 or $30 billion surplus. We had a $30 billion surplus last session. We're anticipating a $20 or $30 billion surplus again this coming session. And we only spend 34 million in childcare. So, 34 million is a lot of money for you and me. We could do some damage. We may even quit our jobs, but it is not a lot of money when it comes to our state budget and what we can do for childcare, knowing especially what that, we're only serving that 13% of those eligible kids. We have 84,000 kids on the wait list. We can do better than what the state is. So when we looked at the data, we were able to look at the quality dollars were spent across all 28 workforce boards, and this is what the breakdown really worked. 82% of those dollars were spent on some type of Texas Rising Star initiative, and we'll get into what that means here in a second. So that was where the biggest chunk was spent. 10% was spent on professional development, trainings, supporting teachers to go back to school, conferences, that bucket of realm. 5% was used specifically on infants and toddlers. 3% was spent on evaluation and assessment. And those are things like using class or using the ASQ developmental checklist, where workforce boards would purchase that for their providers to use. 1% was spent on health and safety initiatives. And then you've got national accreditation support there too with a 0%. There were workforce boards that we had 3 workforce boards that supported national accreditation. The percentage of the money just wasn't big enough to show as a percentage, but it's worth noting that there were some workforce boards that used that. So this is the breakdown of each of the workforce boards. So you can see all 28 there listed. And these are those buckets that were just in the pie chart on how each workforce board used those dollars. So you can see, depending on where you are, what your workforce board did in comparison to other workforce boards. So you can see Gulf Coast to the very far right is the only one that had money in every single bucket. They are the largest workforce board. They are the Houston, they include the Harris County as well as the 12 or 13 counties surrounding that area. It's a big workforce board. If you look over to your left, and you can look at North Central Texas, Tarrant County, and Greater Dallas, those 3 workforce boards together kind of make up the same amount of space and providers as Gulf Coast. And you can see where that breakout was across the board. So then what does all that mean? What does Texas Rising Star supports really mean? And so when we looked at the narratives that each workforce board has to use that submitted with the dollar amount, we kind of found 5 different buckets of where those dollars were being spent. So the first one was equipment, materials, and resources. Those are your magical lakeshore box. Those are your supplies for your classrooms. It could be all the variety of things that dramatic play materials versus science materials versus new books versus new manipulatives, et cetera, et cetera. So those are the things that were under the first one, equipment. Curriculum was a second bucket, where you can see, and that was really like those curriculums of Frog Street and High Scope or teaching strategies. Different workforce boards purchased different ones, so that was that bucket. Third one was outdoor learning, all the materials that go outside. That could be anything from a shade structure to new tricycles, to new Texas Rising Star has an outdoor learning component to it. Could be materials under that bucket. The fourth bucket was Texas Rising Star mentor salaries. Workforce boards get a different pot of money to support the mentor salaries, but it is allowable for them to use some of their dollars of this bucket for those to support those mentor salaries as well. So you can see where there's a piggy bank, those are the workforce boards that included that. And then family engagement was the other bucket that you can see where family engagement was. The other big ticket item was infants and toddlers. So you can kind of see how it's broken down specifically for infants and toddlers across the workforce boards. Again, curriculum and materials, professional development specific for infants and toddlers. We know infants and toddlers need different interactions and have a lot more needs in those realms than our older children. So being very specific with what those infants and toddlers need. Again, outdoors. Again, outdoor for infants and toddlers looks different. Expansion grants. Back in these data was all presented based off data of fiscal year 23, and back in 2023. TWC had expansion grants to promote infants and toddlers. That was money that providers could apply for to switch a classroom from a preschool classroom to an infant toddler classroom. And so those expansion grants and workforce boards added money to that pot. Infant toddler specialist network was another item that some workforce boards participated in. And again, evaluation and assessment. So those ASQs tools and other tools like that different workforce boards supported their staff with. The next bucket of item was the professional development. No surprise, everyone supported trainings in some form or fashion. The next big one was conferences, and those could be local conferences, statewide conferences, even some national conferences. So depending on where you were, CDA supports, and that could be anything from the training to the assessment fee. Texas Rising Star Orientation is one that I always like to highlight, because there was 9 boards across the state that have a specific program around Texas Rising Star Orientation. So if you are a new provider into the system and haven't are new to Texas Rising Star, there's a specific training program and focus on what they're doing to make sure you are onboarded to the program in a successful way. College scholarship was another one. And then we've got 3 workforce boards that have apprenticeships that are using some of these dollars to support apprenticeships. The 4th bucket is the other bucket. And these are worth mentioning because there was a few workforce boards that had others. So the first one was wage supplements, working on, and that ranged from very well thought out across the board wage supplements for retention and training and support, sign-on bonuses across lots of childcare providers across the way, to one workforce board supported one staff person at one workforce board. So, but it showed a variety of those wage supplements. Pre-K partnerships is another one, supporting those partnerships between childcare centers and our either charter schools or ISD programs. And then the child care management system was the other topic area for the other bucket. And those are things like the Pro Care, the Wonder School, the Playground, when workforce boards would purchase that for their providers in their network. So that's how the dollars were spent.
Kim, I'd
yes,
like to
ma'am.
highlight Stephanie Sword had a question about the slide that had the health and safety, like that bucket, that level, professional development, all that good stuff. Well, she noticed that every workforce board had spent money on professional development, but why not health and safety? Do we need to have a health and safety push?
So, that's a very good question. I'm trying to get back to that slide. I think here it is. So this is all the 28 boards and where they were. And so you can see that everyone spent money on Texas Rising Star and everyone spent money on professional development, but not very many spent. You can see health and safety, but it was only that 1% of the pie that spent on health and safety. And I think that's just a matter of those choices. And I think that's actually that one of the purposes of this report is for you to ask those questions and to ask your local boards and local community, are we spending, I'm not making a judgment call on where those monies are, how those monies are being spent in the right buckets, but as people in your community, are those supports going to where they need to be? Is that really what's being helpful to the childcare providers out there? So I think that's a great question to ask your community and those around you of, are our dollars being spent in the right buckets? Good question. Any other questions in the chat box?
Nope, I think we're good right
now. Okay. So what did this all do? What did this all mean? So we spent this, again, this is FYI 23 data. 24 data is just now complete, so we will start digging into that. But this is the results of the quality dollars and how do they support our Texas Rising Star. So each of these graphs, the lighter gray is the providers that are in Texas Rising Star, and the darker gray is the non-TRS providers in each of the workforce boards. So you can see that the majority of our programs across our workforce boards across the board still have a long way to go. Now again, FY23 was a year of transition. We went from we went to centralized assessors, which was a big massive shift in our system, and it has been a little bit bumpy. And we know it's getting better, but this data was right in that middle of that shift. And so we know those numbers have increased over the last year. And we're expecting those gaps to have be much closer to each other, if not the lighter gray surpassing the darker gray as we look at the 2024 data. That there's more programs in TRS than non. And for the first time in history, we can say that we are serving more children in Texas Rising Star programs than non-Texas Rising Star programs. So even though we're not at that 100% that we want to be now, that all of our programs are in Texas Rising Star, we know that parents are choosing Texas Rising Star programs because that's where the kids are. When you look at the number of kids, they're choosing those programs, which is fantastic news, which is why we have Texas Rising Star. So that way we know those children are in quality programs to begin with. This is the percentage of growth from 2022 to 2023. So as we look at workforce boards across the board, you can see the average is right at that 38% of growth across the board. Obviously, you can see some workforce boards had much more growth than others, but this is where that is. And so we'll be tracking that again into 2024 and looking where that growth is and how those providers and workforce boards have really supported that work and really supported their programs to get on Texas Rising Star. We know the last 2 years have been a big push as we have lived into the mandatory Texas Rising Star program. And so we know there was going to be this big uptick. So we'll be continuing to watch and see how long that takes us to get to that. I don't know if we'll ever be at truly 100% because there will always be new programs coming on and new programs in entry level. But what will be that close to norm? Will we get to 60? Will it be 80? Those will be things that we'll watch over the next coming years. So what do we do with all this information? We know where the money was spent. We know what it's done for Texas Rising Star programs. And so what do we do it? So Stephanie, to kind of your question, we kind of think about it in 3 different buckets. What can we do at the local level? What can the state legislature do? And what recommendations can happen at the statewide Texas Workforce Commission level? And so starting with that local community is really we hope that this report gives us as statewide advocates that look at the system as a whole, as well as local communities who really look at your region, the ability to really ask effective questions about, are those dollars going to the places we need it to be? Are those dollars being effective in improving those qualities? We know 2 things changed from 23 to 24. Now workforce boards are required to have at least 1 early child workforce member sit on the workforce board. That wasn't a requirement before. The requirement before was just to have an early childhood expert, and that early childhood expert may or may not have true childcare experience. And so now what we saw in the last year is that we have 82% of the boards have 2 early childhood experts / workforce members on their board, which is fantastic. We know that the more representation we have around the table, the more they're going to make those informed choices. The second thing that changed is in the beginning of 24, all workforce boards are now required to have a child care committee that is made up of stakeholders and providers in your community that are then supposed to report up to the workforce boards, I think at least twice a year. So how is that committee going to be utilized in the different workforce boards to make these decisions on where those quality dollars are being spent? So is there that feedback loop between those two programs, or between those, all the systems and all the players on the people that are in the classrooms and in the buildings, running childcare programs every day, and those that are at the workforce board level that are making those decisions of where those dollars are being spent. So again, really hoping we can use this tool to ask questions and to have informed questions to be able to know what to ask. The second thing around local considerations is really thinking about local initiatives. Prop 2 gave us this opportunity to have those conversations with our elected officials, but so I think it's building in on that and leaning in on that and looking at what can local communities do to really support childcare. We had a great example last week in Austin when they passed the tax rate initiative that's going to support and build, put money in the local coffers for childcare. And so we are super excited about what that program is going to, the fruits of that program as that program gets off the ground. But also, how does that inspire other local communities to have those conversations? And what can we do at the local level to support that? And then thirdly, really thinking about collaborating with our non-traditional partners. Those of us, in our virtual room or in our real rooms, I'm preaching to the choir. You all have drank the child care Kool-Aid. You all know the benefits of what early childhood education does for young children. But how do we get other people to that table and to have those conversations? Those business leaders that don't know childcare, they know their business, but they know they need childcare because their staff need childcare. So how do we bring those people into the fold and really make sure that we are having a holistic conversation around what the community needs? Recommendations for the Texas legislator: invest, invest, invest. We'll talk about that in a little bit. And then also really thinking about focusing on family childcare and how we can support that. Lynn shared earlier that we continue to see that decrease, and we continue to see it. I just looked this week, is continuing to go down. It has not gone back up. So how can we really focus in on our family childcare providers? And then lastly, around the commission, is really just continuing to, how can they continue to improve guidelines and resource allocations so workforce boards know all the creative things they can do with the money, and how they can really make sure that feedback loop is closed with the community, and continue to support statewide collaboration. We've got 28 workforce boards that do things in 28 different ways. And so how can we really build those systems to make sure that they are unique enough to give them the individuality that they need, but also consistent? I'm going to drink water here. But they're consistent enough that providers, no matter where you are in the state, have the supports that they need. So I will stop there. Lynn, any questions that come in before we move on to?
No, I think we have a lot of enthusiasm for the recommendations, though.
Great. I love the hearts and the laughing faces as I see coming through. So again, this is the link to the report. You can also find it on our website, and I'm sure Bree has dropped it in the chat by now a few times, if I'm not mistaken. Okay, so what does this all mean? So we've looked at the money, we've looked at the data, we've looked at how this is supporting Texas Rising Star. So how do we take this information and then inform our advocacy work? And I really think about our advocacy work as this gear of really informing, that research that I just shared, and then getting community input from you and all the stops that we had along our Texas tour, and then on our webinars that we hold in the future, and our conversations that we have with you when you just call or send an email, and all those things add up and churn to then help us develop our policy agenda. And that policy agenda, as we start talking to legislators and elected officials, then they have ideas and we come back to community and we do the research, and it's that continual motion of that piece. And so that's where we live, in that space. That's not just, we do that all the time, every time. So that is where we are as we're gearing up for January. And when I really think about the childcare, I've been using this tricycle as my metaphor, to really make sure that we're thinking about the early childhood system as holistically, that if we've got to think about, and a tricycle is much cuter than a three-legged stool. So there's that. So when we think about a tricycle, we have to think about all three wheels. If we only focus on the brick and mortar facility, do we have the slots? Lynn shared earlier the childcare slots. What does our deserts look like? That's looking at only capacity. She mentioned that's not taking into effect where the educators are, right? So if we're only looking at that wheel, we're not looking at the whole system. We've got to also look at our educators. Do we have the educators that we need to fill those classrooms? And I'm pretty sure the answer is still no. We're still short on our educators, right? And how are we supporting them in their education? How are we supporting them in their compensation? Are we making sure that they are there and we're not only taking care of the ones that we currently have, but we're building that pipeline for future educators to make sure they go into this field and that we have educators there that see this as a profession for their life. And then affordability. We got to think about our families. If we have the beautiful brick and mortar and we're paying our educators what they need, parents can't afford it, right? Parents can't afford it now, and we're not paying our educators what they need. And so how do we make sure that we're thinking about that system as holistically, and they're all tied together through funding, and that funding can come from multiple places. That can come from the feds, like it currently does. It can come from local communities, like our property tax rate would be, and our Austin and San Antonio examples of their local taxes that support childcare. Those things can fund into it, but also it's going to take funding from the state. We have to have all three things, and philanthropic dollars and parent pay fees. It's going to take all of those things to make it really work. And who's in the seat? We all are. We are all in the driver's seat to continue that conversation and continue to move us in the right direction and to pedal our tricycle in the right direction. I use the example of those of us that had a Hot Wheel growing up, Hot Wheel tricycle, and you'd ride that thing and you would do your skids and all the stuff, and eventually that front tire got worn in one place usually, and it usually would then get a rock stuck, and the plastic would break and a rock would go in there, and then we would have the thump, the thump. And if we only focus on one area and not the other, we're going to have this continued the thump. We've got to make sure this tricycle is built like a Kaplan tricycle that will last until the end of time. Those things are indestructible, and so that's what we want to build. So as we approach a legislative session, we also want to take a look back and make sure that we recognize all the work that we have done. We have done, these are the sessions that for the last 10 years, and those are all bill numbers that have been pieces of the pie to move our legislative agenda forward and move our early childhood system forward. And there's some really good bills in this work. For the first time in history, we have an interim charge both in the House and the Senate. An interim charge is a charge from the Speaker of the House and the Lieutenant Governor asking their committees to look at certain things and to study them during their off year. So that way, when they get to a session, they can potentially have a bill and get something passed on those issues. And for the first time in history, we've had one in both chambers. We have traditionally had one in the House. This is the first time that we've had one in the Senate. And so we are looking forward to that. That hearing is actually this week on Thursday. And so we are really reminding them of the good work that they have done, and also pushing them to continue to do the next things. So we are looking forward to that piece, that conversation on Thursday. So what are we looking at for the next legislative session? We have kind of broken it into five buckets. And that first one on the left is the biggest one. It's that invest in childcare. We've got to put money into the system. We know we are not serving enough children. We know the need is out there. We know providers are barely making it. And so we've got to really, and we learned some really good lessons through COVID, and some things that worked and things that didn't work. And we need to put those monies back into where it worked. So one is first direct care. We've got to we've got to pay for more children in those in care. We've got to put state dollars into the system to serve more than 13%. We've got to put state dollars in the system to serve um, all or a portion of that 84,000 kids that are on the wait list. The second thing is to think about reimbursement rates. We know reimbursement rates have continued to improve in Texas, which is we are thankful and appreciative of that with Texas Workforce Commission. But workforce boards are still tied to reimbursing the providers at the lower rate if those providers have a published rate that's lower than the reimbursement rate. So if a provider is in a low income area and charging less than what their reimbursement rate is, the workforce boards have to reimburse them at that lower rate. And so we want to remove that barrier and give workforce boards that ability to be able to reimburse them at the quality rating that they deserve, and they've worked hard and their staff is maintained. And then we also want to think about the child care supply funds and the innovative funding streams. And this is really trying to mimicking somewhat what we learned with from COVID and the child care relief grants. Tarrant County also has had a great pilot going over the last couple of years that have really worked to increase wages for employees, as well as keep costs down for parents, as well as improve overall quality by giving straight funding to providers that isn't based on reimbursement on the number of kids. And we know that system worked. And so how can we continue to build that pilot across the state? The second thing is really thinking about the patchwork of regulatory barriers that are with family child care providers. You know, all family child care providers are fall under the privy of child care regulations across the state. They already have to meet those standards, but some cities and counties and municipalities have added additional requirements to those that is making it hard for family child care providers to start up. And so we kind of want to remove that barrier, that make them meet the health and safety requirements that are required by child care regulations, but not add any other restrictive ordinances that happen to be in the city code or the county code. We also want to prioritize income eligible child care employees for child care scholarships for their own children. We know retention is difficult in childcare. It has been for decades. And we know that one of the reasons they come to us is because they love children, and they also are looking someplace for their own children. And so can we prioritize those employees that are meet the income eligibility for childcare, but prioritize them on the wait list so that way they can stay in their program, and then that also then those providers that are giving free discounts or 50% discounts for those employees can actually recoup those costs of taking care of those children. And so we're making sure that we want to prioritize them. The fourth is really around partnerships with pre-K and really trying to remove some of the administrative obstacles that get in the way of those. Pre-K partnerships are hard and difficult and complicated. This will not solve all of that, but hopefully it can be an easy win and reduce some barriers to really make sure that those can really happen without a hitch, that they can really think about those partnerships without too much more burdensome than they already have to figure out. And the fifth one is really thinking about tax incentives around non-childcare businesses when they are supporting childcare for their employees. What incentives can we get around to support businesses to support childcare? Because we know that we all know, and we know they all know, where we are when they have childcare, their businesses thrive as well. So that's what we're looking at. That's what we are currently working on with representatives and senators. Pre-filing started today, technically yesterday, but with the holidays, so today it's getting off. Bills are starting to get filed already. And so we are, session has begun almost. So it feels like it at least. So I will stop there. Any questions in the chat box?
No questions. I do thank you to the back end support for all of the links that are in here. And I definitely encourage everybody to look at those links, particularly the full report, because this is just an overview of what's in that full report. And there's really valuable information in there for everybody to be able to use in a lot of different ways. It could be used for grant support, trying to move things in your own community, etc.
Thanks, Lynn. And I will say that we are here. So if if you dig into that report and have questions or want to know specifically, or you're on our childcare desert map and aren't sure how the filter works, or you have questions about something, feel free to reach out to us. We will help you walk through that. In closing, here are 3 more links. That first one on the left is the link to the report again. So feel free to download that. The middle one is our link to our legislative district one-pagers. So we develop one-pagers that are for our elected officials. The current ones are up. We are in the process of updating these to the new ones, because we have 32, 34 new House members. And so we will be shifting those to their face. All of them have their face and name on them. But each one has specific data around early childhood and childcare in their district. So if you are meeting with your representative, if you're going to go to a town hall, if you're having them out to your center or your program, or you are coming to the Capitol for a visit, which we encourage you to do too. Please feel free to download those and use those. You can use that in any way you can. So those are there. There's a set for the House and there's a set for the Senate. The third item on the right is our sign up for action alerts. Excuse me. As we get ready for session, we will keep you all posted on when bills are, not so much when bills are filed, because lots of bills get filed and not all of them see the light of day. But when bills get assigning to committees and hearings start to happen, you can sign up for those actions alerts, and we will keep you posted on what's happening across the spectrum of early childhood in those emails. So feel free to sign up for that as well. Any last questions? None? Awesome.
I think that's about a wrap.
All right. Well, thank you again for joining us and being with us virtually. We're thrilled that we were able to do this. This will also live in recordings, so it'll be on Facebook and our YouTube channel. So feel free to share, and we'll send it out as well. But thank you for those of you that joined us live today, and thank you for those of you who have taken time to listen online after the fact as well. Lynn and I are always here to answer any of your questions and support you any way we can. So with that, have a great day, and we will talk to you all soon.
Bye, everybody.